Hello everybody, I'm back with another video for your weekly COVID update. So I'll start with some numbers from the last 24 hours here in Quebec. So we have 613 more cases, continues going down. We have 227 less active cases in the province. Plus we have 834 recovered COVID infected patients or people, if you will. And we have 6 more deaths in the last 24 hours. We have 612 hospitalizations, 122 of them in ICU. What about the doses? Let me tell you about the vaccination. So in the last 24 hours, we have vaccinated 6,500 or 6,560 people. In all, we have vaccinated 438,815 here in Quebec. So these are your up-to-date numbers for COVID for this Monday, March 1st, 2021. Okay, now let me talk to you about some articles I found on COVID. So here in Le Devoir, titled "Almost 1 million less visits at the emergency room in 2020." So I'm translating this as I go along, so bear with me. Close to 1 million less visits at the emergency room. The number really hits the imagination and testifies, here it says, testifies to the severity of the crisis in 2020. That's what they say. So the health ministry here in Quebec has recorded a decline of 906,039 visits in the emergency rooms in Quebec between April 2020 and February 2021, compared to the same period last year. From 3,164,862, the number of visits has declined to 2,258,823. It's a decline of 29%. Which has nothing to do with the fact that the Quebecers are in a better or healthier, if you will. So let me just read you another thing over here. So in the field, this decline of almost 1 million visits at the emergency room doesn't surprise many people, they say here. The patients were staying away from the emergency room because they were scared of the virus. Why were they scared? Now, this is my commentary. Why were they scared? Well, because the media has been pushing fear for the last year. So people got scared. They don't go to the emergency room. They get sick. They die. Collateral damage from government measures for how the government managed this pandemic. So when all this is over, it's very important that the government puts all cards on the table. Because I think, in my humble opinion, that the collateral damage to the government management of this pandemic is going to be much more deadlier than the virus itself. I could be wrong, but that's what I think. That's my prediction. That when all is said and done, and we put all our cards on the table, and maybe a public inquiry on how the government managed this pandemic, we will see that the collateral damage in not only in lives lost from lack of surgeries being put out to its patients by people like in this article that were scared of going to the emergency room because of the fear that the media and the government instilled in them. From bankruptcies, suicides, mental health, when everything is put together and it is shown how the government managed this pandemic, the severity of the collateral damage will be a scandal in itself. But I guess we'll cross that bridge when we get there. So this was an article explaining how there was almost 1 million less emergency room visits in Quebec in 2020. Now look how crazy some public health officials are getting. Okay? Published 2 days ago in the Toronto Sun. Experts call Peel guidelines. Peel is a section of Ontario around close to maybe the suburbs of Toronto, we'll call. Experts call Peel guidelines to place children in solitary quarantine cruel punishment. Drastic measures not supported by science and could have long-lasting psychological effects. Peel Health has issued guidelines to parents instructing them to keep any children who have been sent home because a classmate has tested positive for COVID-19 isolated in a separate room from all other family members for 14 days. Do you guys realize what they are asking parents to do? Not even because the kid has symptoms or has COVID. Just because somebody in his class or in his school has tested positive or has been in contact with somebody that tested positive. So basically they're telling you to quarantine. If your son comes home because somebody in his school tested positive or has been in contact with somebody that tested positive, they're basically telling you to put your kids in solitary confinement. Which, by the way, the UN says solitary confinement is a form of torture. I might not agree with that statement, but it says a lot when the UN says that solitary confinement is a source of, is torture basically, and the Peel public health officials are basically asking parents to put their kids in solitary confinement for 14 days in a room somewhere in their house. The severe guidelines, which apply even to small children who are dismissed from childcare, are being criticized by experts as harmful and not supported by science. This is cruel punishment for a child, especially for youngster children 4 to 10 years old. Dr. Susan Richardson, a microbiologist and infectious disease physician who is also a professor emerita at University of Toronto, wrote in an email to The Sun. Shutting a child off from their parents and siblings for up to 14 days in this matter could produce significant and long-lasting emotional and psychological effects. The handout distributed at Peel Region Schools explains if your child does not have any symptoms, the child must self-isolate, which means stay in a separate room, eat in a separate room apart from others, use a separate bathroom if possible. You see how crazy certain people are getting? That they are asking you to put your kids in solitary confinement in a room somewhere in the house where they eat separately, away from the other members of the family? And nobody sees the craziness in all this? This is not about the virus. This is about ideologies and protecting our children. But I digress. And some of you might say, no, parents will never do that to their kids. It's impossible. Well, here, I'll tell you how possible it is. This mom on Twitter said about this policy, exactly, us too. I have my 7-year-old in isolation downstairs. He keeps messaging me on Facebook Messenger, "Mommy, I'm lonely." My 5-year-old wrote in his journal entry today that he is sad because his brother isn't here. I set up a baby monitor to let 8-year-old ask for things. 5-year-old using it to talk to 8-year-old. Another parent. And so the 14-day isolation begins. Nothing has broken my heart like the sound of my 10-year-old crying while I sit on the other side of the door and tell him 14 days will go quickly, hoping public health calls so we can get some advice and answers. So now we know that some parents are crazy enough to actually do what Peel public health officials are asking parents of doing. And to their credit, they have backtracked a bit today. Not every way. They clarify it. You could go see on their website, on the Peel Public Health website, where they backtrack a bit. But you could go see for yourself. Just the fact of them suggesting it shows you how crazy they are. Okay. Now let me show you how California has gone crazy. It's been going crazy, but now it's getting really, really dangerous. So watch this little video by, if I'm not mistaken, I think this is the California School Board, or one of the school boards in California in one of the counties. Watch this. I'll put it big.
There's never been anything like this virus in our lifetime. Often, it's hard to see the effects it's having on our children. Has this conversation taken place in your home?
Mom, I'm scared about going back to school. I don't want to get sick, and I don't want to get you and Dad sick.
Our scientists tell us there are 3 things we must do to stay safe. Wear masks, make sure we social distance, and wash our hands. And now, your school, with the help of Microsoft Corporation, has created another. Introducing Daily Pass, your exclusive ticket for safely going back to school. Each week, you can schedule your free on-campus COVID test. The results are displayed in your Daily Pass. And if you choose to take your test off campus, you can post the results in your Daily Pass. And the moment vaccinations are available, you'll simply be able to schedule yours through your Daily Pass. But the real magic is your daily health check. Just answer a few simple health questions every day, and like magic, your entrance ticket appears.
Welcome back. Welcome to school. So, how did it go?
Dad, I have to admit, I was scared at first, but then I felt so safe. It was so good to be back. Thanks for keeping me safe. I love you so much.
Here you go, folks. We have gone from Hall Pass to COVID Pass to send your kids back to school. So now here in Ontario, they're asking parents to put their kids in solitary confinement even if they have no symptoms and are not COVID positive. And in California, they're getting COVID passes to be able to send your kids back to school. Are you starting to understand? Here's Dr. Fauci saying that even after vaccination, there's some things you won't be able to do. But don't take my word for it. Take his.
There are certain aspects of being vaccinated and what that means to you personally and your own personal safety and that of your family versus what vaccines will allow you to do in society. One relates to you yourself being vaccinated, and the other relates to the number of people and the relative percentage of people in society that will be vaccinated, because there will be things that you will not be able to do because the burden of virus in society will be very high, which it is right now. Even though we're going way down on the decline that Dr. Walensky showed you, we are still at an unacceptably high baseline level, with the 7-day average being quite high. So there are things, even if you're vaccinated, that you're not going to be able to do in society. For example, indoor dining, theaters, places where people congregate. That's because of the safety of society. You yourself, what you can do when you are together with another person, we are looking at that. And we're going to try and find out very quickly what recommendations could be made about what people can do. One of the things that's universal here that we know that at this point in time, it is unclear whether when you get vaccinated and you might be protected from clinical disease, which is the primary endpoint of the vaccine studies, that you could conceivably be infected, have virus in your nasopharynx, and at that same time have no symptoms, which is the reason why we recommend and say you still need to wear a mask. Because if you do have virus in your nasopharynx, even though we hope that when the data comes in, it's going to show that the very virus level is quite low and you're not transmitting it, we don't know that now. And for that reason, we want to make sure that people continue to wear masks despite the fact that they're vaccinated.
So there you go. Even after you're vaccinated, you won't be able to go eat at the restaurant. You won't be able to go watch a play or a movie, according to Dr. Anthony Fauci. Okay. It's just, I get so, I don't even want to say mad. I get more sad when I hear things like that. It's really discouraging. But I digress. Here's a study published in The Lancet, which is one of the most respected scientific journals in the world. The use clarifying the evidence on SARS-CoV-2 antigen rapid tests in public health responses to COVID-19. So this is not the PCR tests that we are accustomed to, which take few hours, in some cases a day or two, to get the results. We are talking about the rapid tests, which, by the way, the government in Quebec have had locked away somewhere in a storage for months that the federal government has provided us, but the provincial government refuses to use, which could help reopen a lot of things with that rapid testing, which you get result in minutes. But let me read you a bit of the study. The use of rapid lateral flow antigen testing, LFT, for SARS-CoV-2 has been questioned, with uncorroborated reports of poor LFT sensitivity. The debate surrounding the use of the Innova lateral flow SARS-CoV-2 antigen test in the UK risks confusing policymakers internationally and potentially stalling deployment of LFTs in other countries. As scientists and health professionals evaluating some of the world's largest pilots of LFT, we used to challenge those interpretations and clarify the evidence on how much testing might be used to detect SARS-CoV-2 in minutes and improve COVID-19 control measures. Testing for SARS-CoV-2 is central to COVID-19 management and has relied on quantitative reverse transcriptase polymerase chain reaction, PCR technology. PCR seeks the genetic code of the virus from nose or throat swabs and amplifies it over 30 to 40 cycles, doubling each cycle, enabling even minuscule, potentially single copies to be detected. PCR is thus a powerful clinical test, specifically when a patient is or was recently infected with SARS-CoV-2. Fragments of RNA can linger for weeks after infectious virus has been cleared, often in people without symptoms or known exposures. However, for public health measures, another approach is needed. Testing to help slow the spread of SARS-CoV-2 asks not whether someone has RNA in their nose from earlier infection, but whether they are infectious today. It is a net loss to the health, social, and economic well-being of communities if post-infectious individuals test positive and isolate for 10 days. In our view, current PCR testing is therefore not the appropriate gold standard for evaluating SARS-CoV-2 public health tests. There we have it, folks. We're not even using the right tests to determine who in our population has or is contagious. My question is, do they want an accurate screening of who is contagious? I'm asking the question, do they really want that? Because like I said, remember about power. I think they're getting drunk on this new power. And they're going to do everything in their power to keep that power. I don't know if you're catching me. Most people infected with SARS-CoV-2 are contagious for 4 to 8 days. Specimens are generally not found to contain culture-positive, potentially contagious virus beyond day 9 after the onset of symptoms. With most transmission occurring before day 5. This timing fits with the observed patterns of virus transmission, usually 2 days before to 5 days after symptom onset, which led public health agencies to recommend a 10-day isolation period. The short window of transmissibility contrasts with a median 22 to 33 days of PCR positivity, longer with severe infections and somewhat shorter among asymptomatic individuals. This suggests that 50 to 75% of the time an individual is PCR positive, they are likely to be post-infectious. From half to 3/4 of people that are positive with a PCR test might be after they're contagious. Folks, this is right there. So I'm going to repeat. So if you want to go look into the study, it's in the Lancet. And it is titled Clarifying the Evidence on SARS-CoV-2 Antigen Rapid Tests. Put that into Google, the Lancet, and it'll come out. This study will come out. So basically, the tests that most governments are using to see who is positive and who is contagious could be giving a wrong assessment of the contagious patient from 50 to 75% of the time. Folks, this is huge. But I'll continue. Josh Freed writes in the Montreal Gazette, February 27th, whatever is leading Legault to his decisions, it isn't science. When our premier suggests Quebec's failing COVID-19 case rates are linked to our curfew, he's taking credit for a natural phenomenon. Like saying the weather's been warm, must be the curfew. It is that. And I've been telling you this for the past few months. Well, the curfew's been in action almost 2 months. But I mean, that Legault is not following science. But let's go more specific about what he said last week. When he looked at us in the eye during a press conference and lied twice. Once about the explosion in outbreaks after Christmas, which is a lie, a blatant lie, and saying that since the numbers were going down was because of the curfew. As March break looms and our curfew continues, the mind of Premier Legault has become a mystery to me. We've had months of super strict rules, social isolation, and much sacrifice, and we still can't see a friend or relative indoors. So why can we suddenly all crowd into cinemas for March break as of yesterday? In fact, why are we even having March break when last year's had such deadly results? Good question. It's true though. Remember, all year he's been saying that the reason why we have more deaths in Quebec compared to the other provinces was because our spring break was before everybody else's, thus causing a lot of people to travel and come back and infect a lot of people and bring the virus back into the province. I doubt that too, because since he's been lying about everything, what tells me he's telling the truth about this? Why haven't we postponed our break like Ontario? Instead, we're opening movie theaters where up to 250 people can gather and share air. Premier Legault says it's to entertain families with kids. But Quebec's latest figures show the highly infectious UK variant is spreading fast among youth under 18, who account for 40% of Montreal's variant cases. Another 20% of variant cases are among people aged 35 to 44, believed to be parents of these kids. These aren't the same families who will now fill our movie theaters. These are the same families who will now fill our movie theaters and quite possibly spread the variant. whether or not they're eating popcorn. After last spring's disaster, we blame vacationers who went south. When will we Will we soon hear similar stories about those who went to movies? If Quebec wants to ease our isolation, why mass movies? Wouldn't it be safer to let us invite a friend or two into our homes instead of gathering in anonymous crowds in theaters that Toronto and New York still haven't opened? What is our premier thinking? This provokes another question about Legault's decision making, though many readers may disagree with me. That's regarding the 8 p.m. curfew now in force for 7 weeks, denying Quebecers the basic right to leave their homes. Legault says the curfew must remain because it's keeping Quebec's case numbers down. But is it? Join me for a mini math class. On Friday, Quebec's new case numbers were down to 815 from a peak of 3,127 post-Christmas. That's an excellent 74% decline, which Legault largely credits to the curfew. But in the same period, Ontario's daily new cases have fallen 70% from their peak of 4,249 to 1,258 on Friday, though they had no curfew. Alberta has fallen 81%. And their restaurants, no curfew, and their restaurants reopened 3 weeks ago. The entire US is down almost 78% since the January 10th peak, again with no curfews, and much of the country never locked down. In fact, no one in North America has a curfew except us, Quebecers. Aren't we a distinct nation? Yet, numbers everywhere are similarly plummeting. Must only we be treated like children? Disease experts are speculating about why worldwide case rates are crashing. Even India is down 90%. Speculation 1, everyone stopped behaving during Christmas, driving cases upward. But then we all got scared and started really behaving. Yeah. Speculation 2, the disease itself has seasonal ebbs and flows, and for mysterious reason, it's taken a huge global nap. More likely. This is the speculation that's more likely. Speculation 3, vaccines and some herd immunity are starting to help the US and several other countries, though not Canada. So you're it, folks. Another person saying that Legault does not follow science while saying he's following the science. So that's it. That's my weekly COVID update for the week of March 1st, 2021. So don't forget what public health officials in Peel region, in the Greater Toronto area, asking you to put your kids in solitary confinement, not if they're sick with symptoms, but if somebody in their school or class has contacted the virus or has been in contact with someone that contracted the virus. And then we have in California where they're asking you to get your kids a COVID pass to be able to go back to school. We have the study in The Lancet that, I remind you, one of the most respected scientific journals in the world, telling you that the test that most governments around the world are using to see if people are positive and contagious is wrong 50 to 75% of the time. Folks, this pandemic has been mismanaged immensely. But it's time to reopen everything. You can keep the masks in places where you can social distance. You can keep the 2-meter distance if you want, but it's time to reopen our economy. We need to minimize the collateral damage of the mismanagement of these governments towards this pandemic. This is very important. This is a message directly to our government here in Quebec. Reopen. Liberate the people. All right, folks. Thanks for tuning in. Hope to see you next time.